Now you can eliminate varicose veins. Health Source on justnews.com. Vein and Vascular of South Florida can quickly and painlessly eliminate varicose veins using revolutionary laser therapy. Learn more. Visit justnews.com and click on the Health Source tab. Now you can eliminate varicose veins. Vein and Vascular of South Florida can quickly and painlessly eliminate varicose veins. Treatment takes less than an hour. The results are immediate and there's no downtime. Call today. 954-965-4900. Now you can eliminate varicose veins.
All the pain is gone. It's like amazing.
Dr. Fox and her staff are specialists with years of experience treating varicose veins. Call Vein and Vascular of South Florida. 954-965-4900. Now you can eliminate varicose veins.
I'm amazed at the way my legs feel young again.
Dr. Fox and her staff are specialists with years of experience treating varicose veins. Call Vein and Vascular of South Florida. 954-965-4900.
Varicose veins can be eliminated. Since 2001-2002, there's new minimally invasive options that can be done in the office under local anesthetic, and patients can go back to work almost immediately. Patients with varicose veins usually have leg pain, throbbing, itching, aching, burning. They come in describing symptoms of heaviness and swelling and aching, worse towards the end of the day. The new laser that we have is a 1470 nanometer laser, and it's different because it's a higher wavelength than the original lasers. What they found was with equal efficacy, the procedures could be done with less pain, less bruising, and less downtime with a higher wavelength laser. So the patients are thrilled afterwards that they have very little to almost no downtime. Most of them can go back to work immediately. They have almost no bruising and very little to no pain. Cost of the treatment is usually covered by insurance. Most major insurances do cover the treatment of varicose veins because when studies were done, they showed that the quality of life improvement and the risk of developing complications later on was much more costly than treating them early on. Nowadays we do most procedures in the office. It costs around $2,000 for the procedure, but as I said, most major insurances do cover the procedure. What's different about Vein and Vascular is that we are board-certified specialists in the treatment of veins, whereas a lot of other companies do not have trained physicians to treat varicose veins. They just treat it as a side business. We focus on the treatment of treating varicose veins. We specialize in the treatment of varicose veins. We're experts in vein and vascular disease. I love what I do. I love coming to work every day, and I love seeing the results that the patients get. Most of my patients are thrilled with their results and so happy to have legs that don't hurt them anymore, don't throb, don't ache or feel heavy every day. So they're thrilled to see me back, and I just love what I do.
Well, they run in my family. My grandmother had them, my mother had them, and I was a competitive swimmer. I swam for University of Miami, and I was in good shape, and I thought, I'm not going to get varicose veins. Well, I had my first baby, and she was 8 pounds. I had my second baby, she was 9 pounds, 2 ounces, and I had my third, it was almost 9. And with each pregnancy, the hormone change in your body just causes them to come out. So after I had my last daughter, my veins were just, I'd stand when I was washing dishes, or just anytime I was standing for any period of time, the backs of my legs would just ache. So, and hurt and ache and hurt, and I'd have to sit down and lay down, and so then I thought, well, I'm just going to get these done because I don't want to, get older and have them hurt even worse. The first procedure was to shut down the one big vein in each leg that wasn't flowing properly, because varicose veins, the blood's supposed to flow up to your heart, and in varicose veins the blood like trickles down and causes your veins to bulge. So she had to detect in each leg if there was a vein that she could shut down through laser. They make a little hole, they put a laser in, and they basically burn off the vein from the inside, closing it down, and then the blood reroutes to other veins, and that vein is done. Usually that works for about 50% of the patients. That's enough. But for my case, she had to actually do what's called a phlebectomy, which is actually make little pinholes and actually pull the vein out. And then it was done. It sounds pretty intense, but it was actually very minimal. They wrap your legs well, and actually you're supposed to do a lot of walking, because the walking and the foot motion pumps the blood and gets your veins working again. The results after I was all healed were great. Absolutely no pain. I can stand for long periods of time. I never think about it because my legs don't hurt. Like, all the pain is gone. It's like amazing. It was just totally amazing for a very minimal procedure done in her office. It's not done in the hospital. Go home, take care of the kids. A little uncomfortable, you know, the day of the procedure, but it was just totally worth it because now I have no pain.
Call Vein and Vascular of South Florida, 954-965-4900, 954-965-4900.
I've spent about 10 years of teaching kindergarten, and realizing after a 10-hour day I went home and couldn't do much more. My legs hurt so much, my veins throbbed, and I've always been an avid sports person, and I couldn't rollerblade anymore without being in a lot of pain, and I couldn't lift my feet. I started like dragging my legs behind me, so that bothered me, and I didn't want it to be like that. The actual procedure was done in the office, and it hurt a little bit. It wasn't bad. The stockings afterwards that they put on were tight and reinforced a lot of the pressure and relieved the pain. So the procedure for me, I don't think was that bad. I went to work the next day. Phenomenal. I never expected it to work as well as it did, not just appearance-wise, but I went and started rollerblading back to 3 miles a day, working out. I drag and boat race, besides teaching 12 hours a day. I am amazed at the way my legs feel young again. I definitely would recommend Dr.fox to anybody. Yeah, don't think that you have to live your life like that, because you don't. Just because you have the appearance and the pain that goes along with it, it doesn't mean you need to stop. I stopped exercising, gained weight, and didn't feel good about myself. And after the surgery, I went back to exercising, and the legs were able to keep up with me, and then some, because of the surgery, so yes.
Call Vein and Vascular of South Florida, 954-965-4900, 954-965-4900.
My sister referred me. She got her legs done last summer, and I have had terrible varicose veins as well, so I decided to make an appointment and go see what Dr. Fox had to say. And I liked what she said, because my veins were severe. My veins were actually worse, definitely cosmetically worse than my sister's, but they were really bad. They were bulging all the way from the groin all the way down to my ankle, and that was caused, again, through having 4 babies in 5.5 years. They went in and they tried to shut off the veins with the laser, and they did shut them off, and they did shrink considerably, but they weren't gone 100%, because my particular case, they were so large that they had to go in and do the phlebectomy all the way from the top of the vein all the way down to my ankle. And wrap both legs, they had to wrap them, and it was amazing. They just disappeared. It was night and day. If I went from having legs of an 80-year-old woman to having legs for someone my age, and just completely night and day. There was no pain. There was not that I had so much pain beforehand, but when I bumped them, I could wear pants without the veins bulging through. I used to have to wear stockings if I had jeans that were just, you know, a little on the tight side, or pants that were a little on the tight side. I had to wear pantyhose underneath, or else it was too embarrassing because the veins would show even through the pants.
Call Vein and Vascular of South Florida, 954-965-4900, 954-965-4900.